The first time I knew that I snored was back in college. I had a college roommate who told me.
Kept getting hit in the head. You're snoring, stop it.
It was just going to sleep and my spouse not being able to fall asleep with me.
My father snored like a chainsaw. You could hear him in 2 rooms. But we thought nothing of it because we thought, well, it's just snoring. What could it possibly do?
It could be sometime between 2 and 4 in the morning where all of a sudden you just feel like someone has their hands around your throat and you wake up thinking that you're being choked, but you're not.
Sleep apnea is actually when you stop breathing during the night, whether it be 1 time, 10 times, 20 times, 100 times.
It can be at times terrifying.
When you're suffocating in your sleep, the negative effects are incredible.
I stopped breathing apparently an average of 11 times an hour, and that probably what was causing the headaches, the irritability, the mood swings, the need for more sleep during the course of the day.
It was hurting my performance at my old job. There were times where I would, at 3, 4 in the afternoon, just wouldn't be able to keep my eyes open.
It's all well and good to talk about couples and joint problems, but this one wasn't. This was my problem.
The dentist really does see these effects in the mouth. We do see patients twice a year. We are looking in their mouth, and sometimes these effects are so clear that we'll refer to a sleep center for the diagnosis of sleep apnea. The first thing people always ask me when I tell them about the appliance, they always say, well, what does it look like? What am I signing on for? So that's why I made one for myself. It comes in 2 pieces, one for the top and the bottom. By turning the screws on the side of this appliance, you could bring the lower jaw forward at a comfortable rate until you get to the therapeutic position. Stay closed and slide back to a comfortable position. The fitting is relatively easy. Some impressions, goes to the lab, they make a pretty sophisticated appliance. It probably could compare to the cost of a crown. Most insurances do cover a good part of the appliance. There's definitely a couple days to get used to it, but once they're accustomed to putting it in their mouth and once they're using it, I'm hearing so many things.
My husband was astounded. He had never expected any improvement, let alone perfection.
There have been a few situations where I put the mouth guard in and go to sleep. I set my alarm clock, whatever I have to do, and then I would wake up feeling refreshed, ready to start the day before my alarm would go off. You know how refreshing that is?
The domino effect is you feel better about yourself and you look forward to the plans that you have, that you will have enough sleep, to just enjoy your weekend.
Once the mouth guard was introduced, I went from 11 times an hour stopping breathing to 0. It is a phenomenal technology. I'm glad Dr. Lantner brought it into this space, and without sounding overtly dramatic, I owe my life to him because of it.